think drugs are a lot more scary than kids like to say they are. And a teenager's favorite line is, "That will never happen to me," until it does.
Substance use is a very complicated diagnosis. It doesn't just affect the person struggling with it, it affects the family and friends and any other support that they have in their system.
I don't think people choose to drink or use drugs or whatever in excess for no particular reason. It's often people are searching to feel better. There's a lot of kids are dealing with depression, anxiety. Social media is certainly impacting how our kids are coping with their day-to-day lives.
Younger people have different brains compared to adults. Less able to tolerate frustrations, more impulsive, and these are all functions of the prefrontal cortex, a part of the brain which is still developing in adolescence. These substances also affect the same prefrontal cortex. So we have the perfect storm here.
Kids that use substances before the age of 15 are 4 to 6 times more likely to develop problematic use patterns than if they delay their use after age 15. And for every year that they delay their experimentation with a drug, they actually reduce the risks as they get older. So the earlier they start, the higher the risks that they're going to have problems later on in life.
Signs to look for are, do they seem to have the flu a lot? Do they seem to be wanting to sleep, or what we call nod off, during conversations, during meal times, during times when they would normally be awake and up and alert?
The more and more they start to separate from the pack, the more and more they start to spend time in their rooms, they don't come home.
I think you really should, as a parent, just if something doesn't feel right, in my mind, that is something that you should definitely talk to your kids about and have those conversations early, because then your kids will be less likely to feel awkward when they're up against something.
We've got this window of opportunity to talk with our kids about the risks and also to demonstrate how we live and make decisions.
If we can catch even a few people, if we can target a few people in their late teens, early teens, and stop them from using substances, it can make a big difference.
Education doesn't have to start when the problem happens. Education can be a proactive measure.
A person isn't an addict. They have an addiction to something. They struggle with a dependency. That does not make them an addict. It does not make them a bad person. Nobody woke up one day and said, I guess I'm going to become addicted to this or that. Something went wrong, and unfortunately substances work when it comes to being a coping skill.
Understanding that there is changes in the brain that happen when somebody starts using substance, these very changes makes it less likely for them to stop using substances, also will help with minimizing stigma towards this illness.
Parents need to be watching their children and not worrying about, are they going to be angry with me? Will they pull away from me? If your child gets hooked on drugs, they're already pulled away from you. If you can understand what they're looking to fill, you can figure out how to replace it with positive and healthy strategies.